Hello viewers, it's your Dr. Manuela JMD, and you're welcome back to my YouTube channel. Like, subscribe, and leave a comment. Today we are beginning a discussion on polycystic ovarian syndrome, PCOS. Stay tuned.
Just as you said, polycystic ovarian syndrome. You can't ovaries now. Obano Koshiana, send a babeto na wudiamuno. If you baby neighbor, if you want ovaries. And now, you can say polycystic, you can say be a system more of a fluid flow that they say be a issue a tie baby. Okay. So the whole idea is that baby a obano Koshiana free banner or where the egg develops, you know. As a issue at all, just to make it simple. Okay. But it's a bit deeper than that. The problem is such that when you have this condition now, Koshiano, I will say the ebano. It me emba at the end of the month, no, or at the time no say ban because of that issue na abeta hono. So that is mainly the problem happening there with the ovaries, no. The other thing too is that a very big hormonal changes too that come in play with this condition. Or baby, I know you produce what we call an androgen, be a friend of testosterone, a chemical be your body nimuna. It may convert to estrogen. Then no abnormal cycle, no, a regulatory cycle. No. Now when you have this problem, you tend to have more of these androgens in the body, but the body need to mean convert it and estrogen. Here say a baby cycle no either. Most of them tend to have, when you have more of these androgens, I know you're male hormone. And men here no more. That's the testosterone. To both say sometimes they have a lot of facial hair. They have some masculine-like features. Usually it's a symptom. Sometimes they tend to have acne, a lot of pimples near there. Those things are more the effect of the androgens. You know. There's also one of the things that you see. So like I mentioned, in this condition, you know, one they have what we call oligomenorrhea, or in some instances amenorrhea, such that they don't menstruate because of the problem I mentioned. And the second thing is they have a lot of these androgens on arm kind, facial hair, and acne. No? And the third thing you look at sometimes, so yes, scanner, which moves a science,
it doesn't trigger anything within the system. It doesn't show anything apart from because we are about uniform is normal. I know a couple of ladies on my body before are normal to them. Obi as acne is one of them say we hear baby no the iron and na man call what.
Rightfully said, most of them actually don't know these symptoms could mean that they have PCOS. And it's such that it also doesn't manifest early, usually until maybe a late adolescent, called reproductive age. That's what it tends to manifest. Or after the age of Wena. And most of them also don't know. Say these symptoms suggest say they have a condition called PCOS, so they should seek. So those are some of the lapses I need to identify. That's it.
What do you do?
Okay, so with that, you know, we increase our awareness just as we are doing today to make people get to know what this PCOS is. This condition, no, so no, it's a genetic problem. Okay, so there is no identifiable cause. Saying A na abanti na wonya B, but it tends to run in families' genes. But like we have for most other conditions, there's what we call risk factors. It's our risk factors, and we are able to solve these risk factors or address these risk factors, you know, to help with some of the signs and symptoms, you know. Okay, so to better put it, how we are able to address these issues, you know, I think I'll talk about some of the signs and symptoms.
Exactly.
Then how we go about to minimize the effect of this condition. So one of the first things, as I said, you know, is the periods of oligomenorrhea. That they tend to miss periods a lot of times. Koshiano also by the end of the month, you know, the signal is not coming. So for those period of months, they are not menstruating. So your banner or meso periods a lot. It's one of the things that should ring a bell. Okay, and then the other things I spoke about, so the facial hair, any acne, okay, and also as a result of excess hormones, so those are some of the symptoms you may see. Some of the other things you tend to see in some of our patients, and also obesity. Most of them tend to put on a lot of weight. Yes, and also one of the symptoms are you need to raise. You need to come to us, let us assess you for this condition. And for couples, I might try to conceive. I want to conceive a lot of infertility issues, you know. And also could be one of the things I will experience here. You should raise a suspicion, say you could have polycystic ovarian syndrome. So by all. coupled with other things, most of them tend to have comorbid conditions, one including high cholesterol. Because of course, if you are putting on weight, most of them is going to be fat. Most of them also tend to have high blood pressure. Most of them are likelihood of suffering from type 2 diabetes. It's also type 2 diabetes symptoms maybe. Now with this facial hair, okay, some of those symptoms are polyuria, maybe a lot, polydipsia, so come do a lot, a lot. Okay, most of those symptoms related to diabetes, sometimes in a female of that reproductive age, now all these symptoms, when you notice them, you should come to us so that we assess you for this condition.
Is it a regular routine for us as humans to sort of, in the space of maybe a month, 2 months, 3 months, to go check up on in Komoya Uboy?
Yeah, in an ideal setting, almost every 3 months to 6 months, nipa ought not to make a check up because at any point in time, body know to touch him. So let me say in advanced places, I mean, people have, or every family tend to have what we call a GP. General practitioner, a family doctor affiliated to the family. So from time to time, the family is required to go for screenings near there, which will pick some of these things earlier in advanced places. I mean, same cannot be said for us, but I think we are getting there. So once a while, you have to look at the financial aspect of our people and all that. So we do factor those things in. So once a while, within a 6-month period, you can screen for some of these things. It's helpful. So maybe you're able to pick them up before it gets worse.